That's held every year.
Let's get Dr. Hoa Nguyen on in the Zoom room, Doc. Sorry, I know you've been waiting for a while there. Good morning, first of all.
Good morning, guys. Good morning, Chris, Sabrina.
Good morning.
Was there a PAG meeting last night?
I had to skip the PAC meeting last night. Dr. Burt, I asked him to run it just because I had to go down to Tejan to do our second night of vaccination for the GDOE staff. So I skipped the PAC meeting last night.
Well, what did you think about former governor and current GVB president Carl Gutierrez's comments about open the bars already?
Yeah, I don't agree. I think that we have to take one little step at a time. I think bars is still a high risk for spreading the virus. I know our community, the CAR score is very low, but I think that we just have to be patient. Eventually, it will be open, but I think we have to take a little step and see if we can keep the CAR score nice and low. But eventually, they have to be open somehow.
Mm-hmm.
Do you know what happened at the PAG meeting last night?
I asked Dr. Burke to really go over the proposed quarantine regulation. So I think that we will have to come up with a new quarantine. We have proposed that to public health. I know that the next, hopefully soon, that we have a new quarantine guideline. Like I said, we should require some 2 hours prior to arrival, and hopefully we can short up the Q factor a little bit if for testing out 1 or 2 days earlier. But I asked Dr. Burke to chair last night, so I'm going to have a probably report from him this morning.
Mm-hmm. Right. Were they scheduled to discuss the new CDC guideline that went into effect this week regarding the pre-arrival testing?
Yeah, our proposed quarantine guideline is almost the same, as the CDC guideline. So it didn't deviate that much. It just shortened up the course about a day or two for people to be home quarantined for the next 7 days. So it's not we don't deviate from the new CDC guidelines so much. It's almost equivalent.
Mm-hmm. What are your thoughts, though, on the new CDC guidelines and the fact that I think it's if you transit through Japan, you have to take a COVID test, right?
No, I think that to make it it's kind of confusing in the public, and we want to make it very clear that from Guam, transit from U.S. to Guam, or from Guam to U.S., transiting to and from Guam to U.S. Through Narita and through Hawaii, you don't need to have a PCR testing if you transit. Now, if you stay in Japan or you stay in Hawaii, then you have to have a PCR testing prior to boarding. But but to transit, which the majority of the transit go to the state and come back from the state to Guam, you do not need the PCR testing for transiting. So I know a lot of people, I think, misread the guideline, and they pay a lot of money to do that. But I tell you, they really need to know that the transit passenger do not have to have a PCR testing.
Doc,
Okay.
we had Dr. Felix on earlier, and he was talking about the quarantine being the best measure to protect us from the variant. So how are the new quarantine protocols that you guys are going to propose differing from the current ones? And do you think that we'll still be as protected against the variant if the new policies are implemented?
Yes, if you require PCR testing 72 hours before you board your flight, if you're positive, you can't fly. That's one way that we can screen out that someone positive, because they can have very mild symptom, and some people still board the flight when they have symptom. So they test positive 72 hours before their flight, they cannot get on board. That's one thing we can string out. And then when you get here, the new quarantine factor, they're still going to test you out anyway on day 4 or 5 to make sure that you're negative. So if you're positive, it's 100%, you're going to be in isolation hotel. You cannot go home by isolation. That's one way that we protect people on our island from the new variants. Because some people, they positive in the past, and we let them go home for isolation because they live by themselves, and the chances they do not follow the strict home isolation. So by the new quarantine rule, you cannot go home if you're positive. That's the only way that you can protect the island from any new variants to come in. And I hope that public health release a little bit more data for the public, but there's quite a few positive that come out of quarantine factor in the past few weeks or so, because like I said, there's the incidence of positive in the states very high. So it's a good factor. I think last time either a third of the positive come from the Q factor.
Did we cover this? Travelers coming from Narita?
Yeah, yeah. If you could just one more time, just provide clarification. Say I live in Las Vegas and I'm coming here to visit family on Guam, and I go from San Francisco to Japan to Guam. Do I need the a negative COVID pre-arrival test?
At this time, for transiting from the U.S., just like you say, to Guam, you do not need a PCR testing upon arrival to Guam. No, 72 hours before, no, because you're just transiting. Now, if you live in Japan and you fly to Guam, yes, that's international. You will need the negative PCR before you board the plane.
Mm-hmm. And so same thing, if I were to go to Korea, Taiwan, wherever, on vacation for a week or 2 weeks, and I want to come back, and on my way back to Guam, I would not need a negative PCR test pre-arrival.
Oh, you will need the negative PCR test 72 hours. But remember, you go on vacation in Korea and Japan. So that's considered international flight.
Okay.
Okay. I think it's a lot of things. I encourage that before you fly, I know United on their website, sometimes they send out a message. I talked to United and they say just ignore the message for now. This is what they send out, require people to do PCR testing for flying to the state, and that's not. You don't need it. Even you from Guam to Las Vegas, going through Narita or go through Hawaii, you do not need the PCR testing.
Okay. So again, for me, if I want to go visit my parents in Las Vegas, I go through Japan. I do not need a negative COVID test because Guam is a U.S. territory.
Yes.
Okay.
For now. There's no, but it's so very fluid, and so for now you do not need. But you want to waste $150 or $200 a test?
Go for it.
So you don't need it right now.
Okay. All right. How was the vaccination outreach last night, Doc?
We were tasked to do 793 vaccination for GDOE. That's a Cernan and the Central School.
Mm-hmm.
Well, we go from 6 o'clock at night to 8 o'clock at night, Wednesday and Thursday. Wednesday night we do 333, and last night we do 450. So we total 783, so about 10 shy of the tasking. Within those 10 is a cancellation, but it went very nice. I really that's the first time we worked with the GDOE. I'd really like to thank you. I'll send my thanks to Erica Cruz for coordinate this thing. And I tell you, Julieta and her team of GDOE nurse, they're really wonderful. We cannot go through this thing without them. So I'd like to say thank you so much for their support. The Chilean High School gym is a wonderful facility. I wish it was bigger so we can do more, but so we kind of limited in our space. And the mayor of MTM, Rudy Paco, give a lot of support for us, and our the AMC team. We put together a group that you cannot get better. We probably we can do about 200 vaccination an hour. So I hope that the GOE staff went through the process. I appreciate it. The waiting time go through the whole process about 25 minutes from the time they check in and the time they leave. So it's pretty fast.
Right. So how many, yesterday, how many was available and how many was administered, did you say?
We go by some, they sign up online registration through a digital platform, and they sign up, they pick their time, their location, and they fill out all the necessary paperwork online. So by the time they get there, it takes them 30 seconds to check in. So we expect 400 people to come in, and all 400 show up, and we add another 50 at tail end for the walk-in. So we have 450.
Mm-hmm. So there was no leftovers?
No, I heard the conversation with Dr. Brera and Chris, and if you know how many people coming,
exactly, they're registering.
You will open and pre-fill the syringe exactly what the number of people show up. So you don't open any bottle, and so we waste zero shot for the last 2 nights. So that's the way the digital platform, what it does, it keep a live counter of how many people check in, how many the people there that we expected. So we know exactly what we do. So it's something that it had to be used. Number one is cut down the manpower. You know exactly how many people will show up, so you don't overstaff yourself, and you open.
Yeah, you don't waste any vaccines.
Yes, you don't waste anything at all. So we were happy that the 2 night, we waste zero. We have 333. There's a 3 extra because we can draw some bottle. You can draw 11 doses. So that's the 3 bottle. We can draw 11 doses, but we don't waste zero at all. So it's something that technology will help you manage your manpower, your expense, and the cost.
Mm-hmm. Right. Yeah, and that's why we were kind of wondering about the whole friends and family unspoken about policy.
Yeah, some in the clinic wise, it's somewhat different. Supreme Chris in the clinic, because it's not a vaccination site, so you go by appointment, and you can count throughout the day how many appointments you have. So you can open the bottle, but every bottle you can draw 10 shots, and you have to use them. So if you happen to have 3 left end of the day, just because we don't have enough people here, then yes, we create a list of waiting lists. So if we have 3 left, we just go down the list and call them. And bottom line is, if we call one person, they don't answer, we call the next one. And again, this shot belong to the people. It don't belong to anyone else at all.
It's the people's vaccine, right, Doc?
Yes, and the main goal is to get to the people, and as fast we can get them. So that's our belief, and that I think that the majority of provider believes the same. So we can get the shot to your arm, we get the shot to your arm, and we don't want to waste things. Every shot count, and I think that we have to do the best we can. But again, use technology to help you. I think that the guard use even Bright, something like that, the digital platform that they use is efficient. but the first come first service is pretty much is not efficient because you don't know how many people will show up at your site, and you're not going to staff it adequately. You might be overstaffed, you might overdrawn, and that's where the possibility of wasting the vaccine is coming from.
All right, thanks, Doc. Anything else?
No, it's this is the first series, so we're gonna redo again in 28 days for the Moderna. Hopefully, we have enough supply on the island so we can give the GDOE staff the second vaccine to complete those people. So it should be around 783 people that we complete the second dose about 28 days from now.
Hopefully. Oh my goodness, you didn't sound so confident that we were going to get it.
Yeah, we will. I mean, I think that if we prove to the Fed that we put the shot in people's arms effectively, and we can transmit the data to them, say, hey, we use them already, then the most likely chance that they will give to us if we can prove to them that we give to our people on the pace that we're going right now. So if we can have the supply, yes, we do this by July, August, absolutely. If we do it correctly, and if we can get the shot to the people. And again, guys, to me, homebound, I'm still pushing for anyone that bedridden and wheelchair bound. Absolutely, the wheelchair bound people is very uncomfortable for those patients to go to any clinic. We should make all the possible effort to get the shot to the wheelchair bound as a homebound program.
Yeah, well, I mean, did hear from the chief medical officer though that if you're in a wheelchair, it's better that you go because you'll get it sooner, as opposed to waiting.
Yeah. But our opinion is wheelchair bound. We can get them there if we use our manpower effectively.
Do you need Dr. Cabrera's number? We can give it to you. Maybe you can have a conversation.
Good friend every day, so it's okay. I can get home.
He's tired of talking to Dr. Cabrera.
Well, thanks, Doc, for everything that AMC's doing, and of course everybody involved with the COVID response, to include public health and even Dr. Cabrera.
Yeah.
Yeah.
But again, guys, thank you for the GDOE staff for helping us, and will work along with us in the vaccination the last 2 days. So thank you so much.
All right, take care, Doc. Have a safe weekend.
Okay, bye, guys.
Are you going fishing this weekend, Doc?
The water is flat, but unfortunately Sunday is going to pick up again.
Yeah.
That's not the right thing.
All right. Yeah, we're just waiting for our invite over here. Maybe when we get the vaccine, we can all go fishing.
Yeah, I take you out, Chris.
Thank you, Doc.
Okay.
Take care.
Bye, guys.
Dr. Hoa Nguyen, the Physicians Advisory Group. 8:47. Guys, we got to take a quick break, and then we'll come back with Tess Archangel. We have Senator Jim Moylan, the Minority Leader, 36th Guam Legislature, Senator Joanne Brown. I had put out the invite to Senator Talina Nelson to also come on. We didn't get a response. I also asked her about any potential conflicts that she may have in having oversight of the Port Authority of Guam. I didn't get a response, so we'll hold our breath. We send the link out. The invite has been made so that we can have a fuller conversation, but it is what it is. So we'll go with what we got next here on the link.